All right, 2:00. Welcome everyone to the May 26, 2021 Town of Lennox Board of Health hearing. And for the record, we do have a quorum. And hopefully this is the last time I'm actually saying this on a recorded Zoom, but pursuant to the governor's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 18, this meeting is being held via remote participation. To the greatest extent possible, every effort is being made to ensure that any member of the public may access the meeting in real time via technological means. Agendas will be amended to show the link and participation code to access the meeting no sooner than 48 hours before. Recordings and/or draft proceedings of the meeting will be available on our website as soon as possible. This is also being recorded, will be sent to CTSB following the upload to the Zoom cloud. So Madam Chair, the first item on the agenda is the review of the 4/21/2021 minutes. And if you bear with me, I will try to pull up the minutes. There we go. Hopefully it works. So here's the minutes that were sent out previously. I'll entertain any changes or motions to approve.
So move. Second.
Seconded.
All in favor?
Aye.
Okay, moving along, we do have State Representatives Smitty Pignatelli here chiming in, and I want to do a quick discussion on COVID reopening plan and Board of Health considerations for local policies. As you all know, the governor announced a couple of weeks ago in short order that we were going from certain COVID specific sector percentage occupancy limits to full reopening, which is happening 3 days from now. And, you know, there had been some discussion with the chairs and working with Mike Canales, who's a town manager in Stockbridge, Chris Ketchen, town manager in Lennox, and Smitty and some other folks about, you know, what that looks like for us. You know, although the governor is lifting orders, boards of health still reserve the home rule right to enact local measures, you know, due to COVID. And so it's one of those things where we initially had a joint hearing set up to look at possible restrictions that was really going to focus on limiting just the very large outdoor capacity venues. So for example, you know, right now it's still under outdoor capacity gatherings are only limited to 25% capacity. So, I mean, we can use large venues, for example, which say they're allowed 4,500 outdoors. Come Saturday, they can be allowed in the 20,000 range in our towns. And so, one hand, you know, we're getting better with COVID numbers, but in the same hand, you know, there are some concerns still. You know, COVID's not going away. You know, contrary to what many believe with the restrictions being lifted this weekend, COVID's still here and there's still people not vaccinated. And, you know, we're just touching the surface on building a nurse team. We still have to do contact tracing and there's a lot of other things to do. And I just want to have a brief discussion to see what the board members think, to see if there is an appetite to maybe explore at least limiting some of these large outdoor capacity venues just for an extra couple months so we can acclimate the other sectors back into reopening. And it's really just an open discussion to see what board members think. And then if the board is thinking about entertaining restrictions, we can talk about what that looks like in the next steps moving forward. I am having the same discussion with the Stockbridge Board of Health at 3 p.m. today. About the same thing, and then, you know, we'll see where Stockbridge is thinking about, and then moving this along. And I know, Smitty, you know, we've had multiple conversations, and I don't know if there's anything you would like to add before we open it up to the board.
No, I would just like to congratulate all of you folks for the great job you've done. Jim has been on speed dial with several people in the delegation for several months now and really stepped up and done a good job. Me personally, with everybody that I've talked to, whether it be restaurants or hotels or even our theaters, I think people are very concerned about opening up the floodgates. I think Canyon Ranch has some reservations about it. And I think the governor, I think everybody was gearing towards August 1st when things were going to start to be relaxed. And we were all kind of caught with our guard down when he opened it up on May 29th. So I just don't think we're prepared. I don't think that the towns themselves are prepared from a public health standpoint. I think there is some concerns about public safety. And that everybody that I've talked to says, please, Smitty, let's try to be prudent for this year. And let's have, pardon my French, but a kick-ass 22 when we're over this thing and we're ready to really go. So I just throw it out to you. I want to congratulate you for the good work that you've done. And but if there's anything I can do to help, I did speak to the Lieutenant Governor because it kind of caught us all by surprise. She says there's nothing to prevent a municipality or a Board of Health with making further restrictions. Several towns in the Commonwealth took the governor's guidance measures as recommendations and either agreed to do it or not. I guess Lennox and Stockbridge and the Berkshires pretty much have just gone along with whatever the governor has said up until this point. But I really, looking at our economy and the people that I've talked to, I think this might be one time that we said, hey, time out, maybe we're doing this a little bit too fast. So I'll be happy to answer any questions that you may have on any particulars that people may have had. But I just really, I encourage you guys to keep doing the good work that you're doing.
Yeah, and obviously we did read in the paper that they did cancel the Pittsfield 4th of July parade, which draws thousands of people. Some of the street festivals have been canceled, and so I think there's a precedent set there. But yeah, like one of my concerns is like we're just building up a nurse program, and that may not be ready till August, September. And so if we get crushed with potential rates, which hopefully we don't, we'll be left whole in the bag on that. But I'll just really open it up to the board for their discussion.
All right, I'll start. I also fear that we're going to be grappling with some issues that we don't even know about yet as we open up. I think there's a huge appetite for post-pandemic, if you want to call it, the need to travel, but make that travel be closer to home, which means the Berkshires are a destination for two huge metropolitan areas, New York and Boston. So we don't know how many thousands of people may decide that this is the year that we're just going to stay a little closer to home. So for me, we're not going to know who's vaccinated, who isn't vaccinated. I don't know if I trust the honor system as much as I care to anymore. I don't know how many people will come into our town and may or may not affect our own residents' safety. So I worry about our own people in our own town. There's people that for any reason, whether it be medical or age, that can't take the vaccine. And they're going to be out there wanting to enjoy their town too. So if you open up to something like 12 or 15,000 people short term, where there's a quick turnaround, but there's a lot of exposure, I don't know how Tri-Town can do the Maven reporting with us building up a system. That's a huge load to try to carry if something was to become evident that there's an outbreak. So, there may be good reason to think about pulling back the reins on large venues. I'm not saying Shakespeare and Company isn't huge, but maybe there's other places within Tri-Town that may need to think about not having 20,000 people come and go and have our kids park their cars or whatever, and then move the transmission on again. That's my own cautiousness. I know there's other places in the United States that are not following protocols and they're not seeing it go down. It's not going away like people want to believe it is. So that's my 2 cents. I just worry about our own health and safety for the people that we're here to protect.
So Diane, what are you proposing then for something like Tanglewood? I mean, what kind of limit do you think?
Well, right now, I volunteer down. I've ushered there for years.
Mm-hmm.
We went through our orientations and it was going to be 4,500 and they had squared away their stuff for 4,500. Now, would you ask them just to double that? So it's still
So I
with,
saw a figure for 9,000 at some point. I can't remember when that was for.
yeah, I
Yeah.
mean, do we think about doing, this is just a discussion, like, we'd have to have
Yeah.
a hearing if we decided to do something. But, do you say, okay, limit it to 9 or 10,000, never mind, 20,000 people showing up?
Yeah.
Would Tanglewood handle that? Would Tanglewood handle that? I mean, would they think of us as not being nice? I don't know. It's just food.
Here's some thoughts, Dr. Kearns, something we were talking about before with the chairs, we're floating ideas by. So obviously a good chunk of Tanglewood's in Stockbridge, and there's a small part in Lennox, right? So,
Right.
so right now, Stockbridge has a bylaw that they don't allow any more than 18,000 people on any given special event. It's a town bylaw, townwide bylaw.
Pre-COVID, you mean?
So pre-COVID,
Yeah.
so 18 was the number. So like right now, so just say, for example, Tanglewood would be operating at 25% for COVID restrictions. That's about 4,500. If we were to just bump it up to like 50%, and if we put a local restriction only for outdoor large capacity gatherings at 50%, the end of that would be 9,000 for a couple more extra months, and then
Right.
things
Right.
settle out. Now, I will tell you, for full disclosure, I did work with both town councils on putting a draft together to propose to the boards of health. It's only in draft form, and it really talks about only large outdoor capacity gatherings shall not exceed 9,000. And initially, we had it for like Labor Day weekend, but then with the move up from the governor, we were thinking like September 1st. And so I could share that, if we moved on that direction. So I've already done the legwork and the homework, but it's really just sitting idle to get a consensus from the board what they're thinking. And if it's something that Lennox would like to pursue, I would recommend like a joint Lennox Stockbridge hearing. If I can get, if Stockbridge decides at their meeting that they're sort of aligned what the Board of Health and Lennox is thinking, we can just do one joint hearing and public notice and just do it. So it's more efficient for us, but that's what I'm thinking. And I know Dr. Blagg wants to speak too, if he wants to, but it's, we're just trying to put ideas together real quick.
Yeah, and I saw that draft and it looked very good to me. I didn't know how the 9,000 had been arrived at, but thank you. But to echo Diane in a very simplistic fashion, a crowd of Berkshirites is not the same as a crowd in Berkshires. And what we're really concerned about is people coming and potentially spreading the disease to others, or spreading it from the few Berkshirites that may have it to those people. We might not get hit with all of the blowback from that because some of those people will go out with new infections from the Berkshires and end up having their disease someplace else. But still, one has to be concerned about that. And one thing we've learned very well from this pandemic is we don't know everything yet, and we still hold out some concerns for the emergence of variants and a virus that knows new tricks. So I think a cautious approach is really appropriate with as much enthusiasm as one can generate, but still cautious.
Cautious being what percentage? Keeping it at 25 or 50 or what?
Well, the 9,000 would be, we would spell out, we wouldn't do it by percentage. We would just cap off total population, not to include staffing, and just be very clear, whatever we decide to draft to pull to a hearing, we'll just be very clear on, when it goes into effect, when it expires, and shall not exceed no more than whatever.
Right.
But, one thing I'll, to navigate this along, if the board feels that they want to move in this direction, I'm going to ask for two things. I'm going to ask for a formal motion to agree upon conducting a hearing. And then two, before we leave, we should come up with some dates, because we would want to do this quickly, but still be in compliance with the open meeting. I need at least a week to put a notice in the paper, set up agendas, and kind of do that. But so first, why don't we, so if the board is
Any more questions?
interested, if there's any more debate or discussion before we move on, what's the board should vote to agree to a move to a public hearing, and then after that motion passes, we should come up with dates like now, because it's super busy and I want to make sure we navigate this soon because it expires Saturday. So we need to move this along as quickly as possible.
All right.
Jim, could I add
Sure.
a couple? I appreciate all four of you, all three of you as board members' comments. When you look at, like I say, we are all planning on August 1st, and we kind of got thrown a curveball a little bit 3 months in advance. But when I look at Crapalo not opening up until the middle of August, they've recognized to proceed cautiously. BUTI is not coming here this summer. I've talked to Mark Volpe several weeks ago, and even the Tangwood students that they have coming here, which are international students, they're going to be with some strict guidelines. They're going to be, I was told, renting rooms at Crapalo with strict orders. You're going to be in your dorm room and you're coming to Tangwood, and then you're going home. They're talking about boxing lunches and things like that. So they're not going to have the infrastructure this year. There was no popular artist concerts early in the year. So whether you settle on 7,000, 8,000, 9,000, I think it's irrelevant. And as Diane knows, being an usher there for so many years, on a normal Friday, Saturday, or Sunday afternoon BSO concert, they get maybe 6,000 or 7,000 there to begin with, if they're lucky. So I just think everybody's going to feel a lot more comfortable to proceed cautiously. And I would echo the doctor's statements about, let's be smart. This is not just the Berkshires. This is an international destination, and let's be smart about it so we don't jeopardize losing any more of our local economy if we have a fourth wave, or maybe the Indian variant takes root someplace, or something else happens. I think we better be wise than foolish.
Mm-hmm. Mm-hmm. I agree. Does anybody want to make a motion?
Sure, I'll make a motion.
Okay. And that motion is
That was for the public, or for the open meeting, with the public meeting?
to have a hearing into the discussion of
Yeah,
meeting with Stockbridge to
right.
discuss limiting the number of people at outdoor large venues.
And the dates.
Does that sound correct, Jim?
Why don't you do the motion first to move towards a public hearing and get the votes, and then we'll set up dates.
So I have move a motion to have a public hearing for the capacity.
Second. All those in favor?
Aye.
No?
Aye.
All right.
Does next Friday, June 4th, look reasonable to get a quorum for a Lennox Board of Health? I'm open all day on Friday to June 4th.
I work Friday afternoons, but I'm usually out by 5, so
Can we do
Can
an
you
evening?
can you do mornings?
I could do mornings, yeah.
John, anytime until when?
I start at 1 usually. I get there by 12:30.
So between 9 and 11 seems
Yeah.
reasonable? Okay.
Yeah,
Dr. Blagg?
My restrictions would be, it'd have to be after 9:15. And before 1 o'clock. It's tight. I know it's tight, but
Well, it's all contingent upon Stockbridge's availability too, but if we have to do separate hearings, we'll do that. I just want to get a feel. Is Thursday better for you folks instead of Friday? The 3rd?
I think Thursday's okay. I can't remember. Let me look
Oh,
at
it's
my,
okay. I could,
Thursday would be a little freer in terms of the time after the 9:15 in the morning.
okay.
I have
think
I have a meeting at 1 on Thursday, but otherwise I'm free.
And I have
Yeah,
a news appointment at 10:15
okay.
with Parhiskar. You know how easy it is to get in to see him every 6 months.
So ideally Thursday, 9:15-ish, or Friday between 9:15 and 11.
Mm,
Sure.
That seem reasonable?
Yep.
Yeah, and I'm not looking for a vote on it. I'm just looking consensus because I don't want to spin my wheels trying to figure out dates.
Okay.
Because it's gonna have, I need 48 hours to post it, but I need 3 or 4 days to get it into a public notice because the Eagle takes a little bit of time. But I'll throw those same times and dates when I meet with Stockbridge, and that's all we have for now. I have Dr. Henry Rose to present his thing, and if we have time, when he's done, we can circle back and I can give you some quick updates on
We do the
reopening.
chair, we're supposed to have reorganization after an election, and Dr. Blagg is now formally a member of the Board of Health. He's not appointed, he's
I
actually.
didn't wear my tux today though, so I don't know how formal it is.
But we're supposed to every year go around to see if anybody would like to be chair. I don't know if either of you guys would want to assume that role.
I think you're doing a great job, Diane.
Oh, thank you.
I'll echo that comment.
Okay, so I will put it down, Jim, that I'll be chairman again.
All
Do
right.
we have to vote on that? I don't think so.
Yeah, you could entertain a motion and vote.
So moved.
Second.
Okay, all those in favor? Aye.
Aye.
Thank you.
All right, thanks, Smitty. So moving on, we have Henry Rose, who has been reaching out to us.
Yeah,
Sorry, Smitty, go ahead.
but was the board going to talk about a date, or is that going to be for later
Tentative
discussion?
dates, we're looking, hopefully I can get Stockbridge on the same calendar, but possibly next Thursday or Friday.
No. What I meant is limiting the capacity until a certain date, not so
Yeah,
much.
well, I was thinking like September 1st. I think that's a good,
Okay.
that's a good draft. I mean, the board can make a motion and amend during the public hearing process, but I was thinking, effective the date of the vote till like September 1st. That gives us a little bit of time for
Yes.
Capello to acclimate, BSO to acclimate, and then, and the board still reserves the right to extend it if the numbers start to, rise up the way they are. But I was thinking like September 1st, but
Yeah, I think that would be great, and that would give you guys the opportunity to reevaluate for apple squeeze potentially in Lennox. I know this is not a lead conversation, but I saw in the paper today they're already talking about Founder's Day weekend, which is always a big event as well. So giving you time to reevaluate and look at how the summer went with large capacities could help you chart out September and October as well.
totally agree. Yeah, and I'll craft a draft with the town council if Stockbridge decides as well, and then we'll just move it, and then we'll entertain comments and stuff during that process. So,
Great.
all right, great. Thank you, everyone.
Thank you.
Ew.
All right, so we have Henry Rose to talk about peaker plants. Henry, do you want me to pull up the PowerPoint, or do you want to just let me know how you want to navigate your dialogue?
The PowerPoint would be great. Thank you, everybody, for having me. My friend Rose Wessel from our volunteer organization, No Frack Gas and Mass, is on. We're also allied with Berkshire Environmental Action Team. Hi, old friends. It's nice to see you guys. You look well. I'm going to speak briefly about the peaker plants, and then Rose can answer questions that you might have. How many minutes do I have, Jim? I know you're on a tight one.
Jim, you're muted.
Am I muted?
Yeah.
No, I'm muted.
You're not.
We're good till 3, so
Okay,
most of
okay.
our action items are done.
All right, I'll try to be quick anyway.
You just tell me to advance the slide, Henry, and I'll do it for you.
Okay, that's great. So, first I want to start out by saying I used to live within a mile of a peaker plant, and I had no idea that such things existed and how terribly dirty they are, and how our air quality in the Berkshires is not necessarily excellent, even though we live in a beautiful environment. If you check the air quality index, you'll see that we're in the moderate range more days out of the year than you would care to admit. So peaker power plants are plants that come online on the hottest days of the year, usually the days of peak demand, hence the name, usually when everybody's turning on their air conditioner. And these plants only work for a few days out of the year. They're expensive to operate because they have to be maintained, and they will fire up on days that they expect to have peak demand when other energy sources for electricity are exhausted, and we have to then rely on these antiquated, dirty plants. The Pittsfield generating plant in Pittsfield is 30 years old. The one in Woodland, Lee, which is near you guys, is 60 years old. And the one on Doreen Street, Pittsfield, is 50 years old. They spew a disproportionate amount of pollution, and they are very high on emissions, including the PM 2.5s, those very small particles that go deep into the lungs and are implicated with bad outcomes for cardiovascular and pulmonary health, as well as nitrogen oxides and sulfur oxides. So they only run for a few hours, a few days a year, mostly the hottest days of the year, although they could occasionally run on the coldest days of the year where natural gas demand is used. They burn fossil fuels that contribute to unhealthy air pollution. The 3 emissions that they have are listed, and Pittsfield generating is the big one in Pittsfield. Those are the 3 smokestacks near the old GE. And they might even use PCB contaminated water to cool their system. Next slide, please. Jim, are you able to advance the slide?
Yeah, for some
Okay.
reason, yeah.
I can keep talking even if you can't advance the slide, though.
Yeah, it's
So,
one
you know, the
second.
connection between air pollution and human health is well established. The World Health Organization estimates 4 million deaths globally a year related to air pollution. And some of these plants are exempt from the Clean Air Act. They are so old. And of course, they are implicated in climate change with carbon emissions. So from the point of view of climate and air pollution, these are things that are relevant to a Board of Health. Yeah, side effects like reduced lung function, asthma, cardiovascular disease, preterm birth, children and the elderly are most vulnerable. And, you know, you don't have to be a genius to make the connection between air pollution and asthma. There's even a link between outcomes, bad outcomes with COVID-19, mortality with COVID-19 and air pollution. Next slide, please. So there are 3 plants, as I mentioned. The one that's closest to you is the one on Woodland Avenue in Lee. And believe it or not, the primary fuel that it operates on is kerosene. Can you believe that? Sometimes on oil. The one on Doreen Street, Pittsfield, also operates on kerosene. And I used to live near that and had no idea that it was there. Sometimes on oil. Pittsfield generating runs on fracked gas, mostly. And, you know, there's no accounting for how some of these plants are situated in a way that there could be overlap, that multiple plants could be hitting vulnerable people in multiple ways. And a lot of these are situated near schools, neighborhoods, and so-called environmental justice communities. And as members of the Board of Health, you probably are familiar with environmental justice communities, how the poor tend to bear the brunt of toxic emissions of all sorts disproportionately. Next slide, please. So this is about Pittsfield generating. It's now 31 years old. It contributes to greenhouse emissions and other toxic emissions like nitrogen oxides, sulfur oxides, where they have reapplied for an air quality permit this year. Next slide, please. And they are in the backyard of Allendale Elementary School. You've probably all driven by this at some time. It is right next to Allendale Elementary School, and it's not that far from Morningside Elementary School, which is an EJ, an environmental justice neighborhood. Keep going, please. Next slide. Doreen, 51 years old, high emissions, near Williams Elementary and Egremont Elementary School. And again, it's old enough that the Clean Air Act doesn't apply to them. Next slide, please. And environmental justice communities, the poor communities, are especially impacted by this. Next slide, please. Woodland Avenue is the one closest to you. 61 years old, using mostly kerosene. Bad actor. It should be replaced. Next slide, please. Our organization has reached out to the plant ownership, but we still have not heard back yet. There are two different companies that we're trying to deal with. So far, to my knowledge, we've not had a response. We would like to meet with them. We would like to hear what their plan is. And it's especially important because we know it has to be done. If we're going to meet the standards set by our legislature, we have the Global Warming Solutions Act passed by our legislature. It's been in place for a number of years. And we also now have a roadmap bill, as we call it, that is in place. And in order to fulfill these, we know that the industry is going to have to change. So we want to push them to change and change soon from the point of view of climate, air pollution, human health, and also cost. Next slide, please. We are asking you guys to sign on to a petition. Next slide, please. And I think that's it. We're asking you guys to sign on to a petition as health professionals, identifying yourself as such. Hi, Michael. Hi. Identifying yourself as such, urging that the owners of the plants change their business model, change to battery storage and green energy. And if we had our way, they'd be using flow batteries and they'd be using solar. The solar does not necessarily have to be right on site. We have the technology, we can do it. I'm aware that a municipality in Pennsylvania, I believe it was, has already done such a thing. Across the state, we have something like 23 such plants. We should retire them all. And what we want to do is push the industry to make a change. You get to decide if you want to do this as individuals or collectively as a board of health. I also want to encourage you as individuals to do something I've done. There's an app, there's a website you can go to called shavethepeak.org. It's easy. It gives you text alerts on your phone to tell you on days of peak demand, to advise you what days, what time of day you should run your dishwasher, your washing machine, and that sort of thing, so that you can just make an impact with that, because the peak has already been somewhat shaved. I want to add another thing, though. Even if you're a climate skeptic and an air pollution skeptic, from the point of view of cost, the wholesale cost of electricity is driven up by the most expensive energy that's being used. So when these plants come online, they set the energy costs for all the other types of energy. So they're very expensive to operate, and it's costing ratepayers like us more than they should. So it's time to close them down. I'll put in the chat, Shave the Peak, so you can sign up for your text alerts yourself. And Rose would be glad to answer any questions you have, because she has really devoted herself to becoming one of the regional experts on this.
I have a question. Has there been documented increased pulmonary issues in patients near these plants, or any other issues?
That's hard to answer. Rose maybe can answer. To my knowledge, there's only one air quality monitoring station on Silver Lake Road, I believe it's called, in Pittsfield. There's only one in the area that gives us any real data. It would be neat if you could try to find a link with ER visits and high emissions. I couldn't find that data when on the internet. Rose, what do you have?
We did find at least a weak correlation. There was a monitor at Allendale School for a while. And the days that the plant ran, you could see an uptick in the pollution levels that the plant put out. A direct correlation to health information is hard, because we can't find health information beyond a gross aggregate for the entire city.
Right. And also the Clean Air Act, I mean, so they're grandfathered in? That doesn't apply to them? I don't understand that.
They were built before it was operative, so they're grandfathered in.
Wow. And that can't be changed in the legislature? Or?
No, we're talking with, right now we're talking, we've already talked with Marky's office. We're about to talk to Warren and Neil's office. We're largely talking about what funding might be available through all these new programs for transitioning to clean power, but we're also asking about that, whether or not there can be a change, but it's pretty much written in as the Clean Air Act.
I see Michael's proudly showing us Shave the Peak on his phone.
That's the program. It's very handy.
And I pulled all the links from the chat and I'll forward it all to the Board of Health members so they have access to that as well.
Okay.
Thank you.
Yeah, that
Thank you.
first link to the health petition, that was the edit version of the form. It's the second one that I posted. That's the operative form.
Okay.
Getting back to Dr. Kearns' point about the grandfathered one on Woodland. So that means if there's no permits, there's no particular air sampling testing done by DEP or EPA. So they just do whatever they want and that's it.
That's basically it. Yeah, there's no oversight. It's old enough that there's no oversight.
I don't think this is a new story for industry, Jim. For example, I watched a documentary on PFOA and PFAS, and this is what the chemical industry does, and industry in general can do. They can put stuff out, it's been used, and then it's very hard to backtrack and say, wait a minute. And then if they do get a law against them saying, okay, you can't spew that, then they modify the chemical substance slightly in the chemical industry so that they can avoid the regulations. Michael came online. I'm wondering if he wants to chime in on something.
Oh, chiming in. It's so obvious that these plants need to go. I don't know if we're going to have to picket them or do something to increase awareness, or is there any way we can refuse that power? I mean, I have solar units on my roof, so I don't get much power off the grid. So especially at the peak time, so I don't know what other people can do.
It would be tough to refuse the power. ISO New England has Massachusetts divided up into demand zones, and our demand zone is basically anything from west of Worcester over to the border. So when the prices drive up, when these run, it drives up the entire wholesale market. It's that demand zone that determines what that price is going to be.
What will signing this petition do? I mean, is this part of a larger population that's going to be signing, or what?
Yes, it's healthcare professionals in general, and including Board of Health members, and it's anyone in the Berkshires that's signing this one. It'll be useful for the air quality permit for Pittsfield generating. We're spreading the word on the Woodland and Doreen plants as well. We've been going door to door and doing flyering, and many of the responses were similar to Henry's. They had no idea that there was one right in the middle of their neighborhood. We also are approaching the owners. Smitty and other legislators from the Berkshire delegation are now signing on saying, we really want to have this conversation about what your plans are. You know, are you going to transition? We have some research on ways that that's possible. We're looking at, we're already talking to the congressional, our congressional delegation about what kind of funding might be coming down the road to help them switch. And if not, do they plan to retire? Some of these peaker plants are retiring. There's 24 of them across the state. And there's a brand new one actually being proposed out in Peabody. That's a gas and oil fired plant. And they argue that it's much more efficient than the old ones, but it's still a fossil fuel plant when there are clearly alternatives that are pretty much, comparable in cost, especially when you take the volatility of the fuel costs into account. So 2 of them are retiring, one in West Springfield and one in Chicopee have filed to retire. Their business model is going away. It's just going away slowly. And we're hoping to push the process by helping them transition. Transitioning also makes the most sense for making sure that power stays on the grid. They're already connected to the grid. They're already at substations. So it's easier than finding a location for an alternative system. And I looked at the way that they could become peaker storage instead. They don't have to have co-located renewable sources. The renewable source could be somewhere else. As long as they're charging while that renewable source is running, it's considered clean energy. So the mechanisms are in place for them to make this transition. I don't know that there's been much of a push for it yet. And that's what we're working on doing.
Madam Chair, if I can, a couple points of order with respect to the ask. There's like an online petition that any individual can go on and sign on for a petition, but then there's that. But so if the board wants to entertain a motion to actually, as a board, give a letter of support or, let us, so there's that motion. And if you're interested, and if the board is agreeable to sign a formal document as an entire board, get me a draft letter of support, who it goes to, and some content, and the board could do that. But, obviously, if the board is agreeable to that, I would like to see a motion for that, Madam Chair, in a formal vote, and then I can follow up with the folks afterwards to obtain those signatures. And my last point is, I know Henry brought up the PFAS issues. Well, DEP and others are really honing in on the PFAS issues. Those are the forever chemicals. They're getting into water supplies, and they're really hard to get out. And it's hard to get those chemicals out once they've been deposited. And another thing that I'm discussing with Stockbridge is the local mosquito control program and other communities in the Berkshires that use their service. They're under investigation by EPA because I guess the containers used for those pesticides had PFAS in them. And one of the things that the Stockbridge Board of Health is really concerned about is that the mosquito control program uses adulticiding in high quantities. Luckily, Lennox is not part of that program, but like once PFAS and other chemicals get into the watershed and water supplies, it's hard to get them out. And so, yeah, I know DEP and others are really honing in on the PFAS. They actually have a budgeted program right now to do well monitoring in certain Berkshire County towns. I know Otis and a few others have been selected for homeowners to test for PFAS. And so it just goes back to the point, like it's too little too late. We destroy the environment, then we try to invest billions of dollars to fix it. So if we can get ahead of it, but if the board is interested in signing a Lennox Board of Health petition collectively, they can have that discussion real quick.
Hey, guys, what do you think?
I'd like to make a motion that we sign as a board.
I'll second that. I don't see how it could hurt.
I put links to the letters to the owners. You're lucky that Adam Hines kind of dragged his feet on getting back to us. But he's now agreed to sign as of this morning. So we have those still ready to go out if you wanted to join on as signatories on those letters. One is to the owner of Doreen and Woodland, which is NAEA. They have a West Springfield office. And the owner of Pittsfield Generating is Hull Street Energy in Bethesda, Maryland.
So Rose, do these take the place of the tiny URL that I put in the chat way before you got on?
Yeah, probably. These are the letters to the plant owners.
Okay, so the two that you're seeing here posted by Rose are the ones we want you to click on, guys.
Yeah, and if the board can't access it, I'll send the links afterwards.
Okay.
Thank you.
You're welcome.
Thank you for your time. I think
Thank you for yours. By the way, do you guys mosquito control the
No.
way Pittsfield used to and the way Dalton doesn't? No, good. Glad to
we've
hear.
had a gentleman come down maybe twice, Jim, to talk to us in the past, and we have
Yeah.
deferred. the need for that.
I'm glad to hear that.
Yeah,
What about-
Pittsfield
what
is part of
about
mosquito
single?
control.
Actually, I heard they opted out. In their last meeting, they opted
No,
out.
so the city council doesn't want them to spray anymore, but they're still part of the program. It's two different things. And mosquito control is one of those controversial topics where, West Nile virus and Triple E has very low prevalence in Berkshire County and Western Mass. We've never had a Triple E case. We've had a handful of West Nile virus over the years. But again, it goes to, adulticiding should be used as a tool when necessary, not to be used as a nuisance program, meaning, I don't know, I'm going to have a Memorial Day party this week and I'll call it mosquito control to spray my backyard. It's not meant for that, but I know these are EPA approved chemicals, but like we shouldn't be introducing anything unnatural to the environment unless it's absolutely necessary as a public health threat. That's just my personal philosophy. So Lee and Lennox has never been part of it. Stockbridge has been part of it forever. And I know they're looking at options to explore that, but that's a Stockbridge thing. We're on a Lennox Board of Health meeting. But again, it's just chemicals in the environment, honeybees and other, it just messes up the ecology, of our environment. And I think as human beings, we just tend to, we want the perfect outdoor life, right? We don't want to be bitten by anything. We want to sit there and we're taking up all the wilderness for the wildlife, and heaven forbid you get a black bear in your backyard. But we are in the Berkshires. There's still, once these chemicals get into the environment, and I figure we would have learned our lessons over the years with PCBs and all these other things that we just keep repeating ourselves historically, and we're just not learning as we go, because once these chemicals get into the environment, they're hard to get out.
Glad you feel that way, Jim. Well, guys, thank you so much for the time you gave us. You were very generous with your time, and I consider you all allies.
Yeah,
Thank you so much.
Thank you.
Thank you. Be well. Take care.
Bye-bye.
Bye-bye. So Jim, getting back to business, PPE distribution, did you get anything today, or is it going to our town halls?
I was getting something here, but I've been on Zoom for the last 3 hours and I have not checked the hallway. That's supposed to be coming today. So we did ask for some. Real quick as we wrap up, getting back to some other updates. Everyone's aware that we've been awarded a very significant amount of funding to build a Southern Berkshire Public Health Nurse Program. We're working on that. We're still looking for a second nurse. We do have a nurse leader that we've offered a position to, and I'll make that announcement relatively soon. And it's just super exciting to build a regional Southern Berkshire comprehensive nurse program that's never been offered before. So that's very exciting. And I want to thank, Smitty and the legislature for pushing that funding to the state to start empowering local boards of health so we can build our own capacity rather than relying on third parties and planners to do it for us. We need to get back to that. COVID has taught us a lot of silver linings in COVID. While I feel Tri-Town as a district responded well, the nursing piece was a big weakness for our district, and we need to correct that and build something new. So that's going on there. And with the reopening as well, I'll see what Stockbridge is thinking, and I'll try to navigate that process. But I know there's been some discussion, Diane, about the travel advisory. If that goes away this weekend, if the board remembers, they changed the travel mandate several months ago to advisory.
Yep.
I did confirm with DPH today that there's no language in the governor's reopening release that the travel advisory is going away. So I think the narrative is although sector specific COVID rules are going away this weekend, the travel advisory will still be in place. And in my last parting commentary regarding the reopening, just the fast and the furious going from first gear to fifth gear on reopening, I was hoping we would going to do this incrementally over time and then just finally just go from, 75% to 100%. Just, it's happening so fast. COVID doesn't go away on 5/29, folks. When I'm telling businesses, they're calling up asking for signage, what should they do? Theoretically, masking and all that goes away this weekend, but like, if you have unvaccinated employees or people in COVID spread, quarantine and isolation is still required, and that could affect a business if they have low employee or vaccination rates. So COVID's not going away, and isolation and quarantine mandates are not going away. And I hope that the risk is low. The higher the vaccination rates, the better protection we have. But it's not like we just flip a switch and COVID disappears this Saturday. So we need to continue to do our due diligence, practice safety, continue to sanitize and mask if people feel like they need to mask. And so I'm excited that we're almost back to reality again, but I have a lot of sleepless nights and anxiety about what's going to happen over the next month once we get full reopening this weekend. So,
Jim, are any businesses requiring proof of vaccination to come in to their business without a mask?
Not that I'm aware of.
No.
Not that I'm aware of.
Mm-hmm.
Has there been any attempt made to educate people who come to the Berkshires about what is happening here in terms of this being advisory, and these are the advices that are given? I was thinking about people coming from St. Elsewhere's and coming to the Berkshires and being confused because at home they have one set of expectations, and here we would have perhaps another one, either higher or lower. Would there be any utility, for instance, to set out some sort of signage, not necessarily obtrusive signage, but just simply as signage, for instance, in the center of Berkshire, center of Lennox, just saying these are our local advisories about who should wear a mask, social distancing when required, be aware of your own vaccine status, because this is what you can do if you're vaccinated. This is what we advise not doing when you're not vaccinated.
Yeah, I mean, we're pushing a lot of information to the businesses and the chambers as we speak, of the lifting. I will tell you that Mass is a lot more restrictive than the other surrounding states. So they're probably coming from a place that hasn't been masking in quite some time. But no, duly noted, and we'll have to investigate, see what we can do that makes sense. And the problem is it's going so fast. It's like trying to adapt and push out a comprehensive education plan is a tall feat.
And you may have the paint dry on the signs and then have to change the signs too.
Yeah, absolutely.
Understand that.
All right. Any other questions for me while we have 7 more minutes?
I don't have anything.
Hey, Jim, could I just chime in for a second?
Sure.
I like Dr. Blagg's idea, and I just wondered if maybe you could send out just some general do's and don'ts to the Chamber of Commerce to disseminate to their membership. That would cover the hotels and the restaurants and the retail at the same time, just to give them some guidance. I think it's a good idea.
I know you've been doing that all along. When the pandemic started, I remember, a year ago, last April, things were sent out, and there have been updates, and actually on our Tri-Town website, people can go to the town website and see things too. But the more the merrier, if we can get more people in on, putting it around. There aren't any places in town where you can go for a community bulletin board to even glance at things in this town.
Well, with all due respect, I mean, for those of us on this screen that have traveled, I don't remember the last time I ever went someplace on vacation and checked the Board of Health website.
Yeah, I know. I'm hoping businesses look at it all the time.
Even if you could get a business to put, these are our local advice. This is the local advice regarding.
Well, where we should think and work on is Matt Tannenbaum on the outside of the bookstore.
Yep.
He has
Good
that
place.
wall there that he lets you put things on, and more people walk up and down that street than I think other streets in Lennox.
Well, maybe we could pursue an electronic bulletin in historic downtown Lennox for our
Oh.
messaging.
No, there's a
Oh,
lot of
Gary.
good valid points. I mean, you've got the library, and a lot of people walk into the library to browse because it's such a beautiful historic building, that if we could have our advisories posted in a few spots in town, that would be very helpful.
You know, we'll try to work on something as things are moving quickly. All right, motion to adjourn.
I make
So
a
moved.
adjourn.
All right, thank you, everyone.
Thank
Thank
you.
you. Thank you very much.